A state disaster.
Fourth Mayor Betsy Price is expected to announce a stay-at-home order.
Dallas County will move to a safer-at-home order.
Hello everyone, we're from Group 4. In here we're talking about the COVID-19 pandemic's impact and future arrangement using Neoliberalism Theory. In this slide is the table of content of our group. The first is introduction, the second is actors, the three, level of analysis, the fourth, the tenet of the theory, and the next is origin or history, and the next is impacts and future, and the last but not least, conclusion. And this is the member of Group 4.
Hello everyone, my name is Olimpio Santos de Silva, and in this video we are going to explain to you about the COVID-19 pandemic, the impacts, and also the future arrangement. So, the COVID-19 pandemic has had a profound global implication touching every facet on the society, and its response can be analyzed through the lens of neoliberalism theory. The neoliberalism, a prominent economic and the political ideology that emphasize limited government intervention in the markets and privatizations, and individual responsibility as well. In the context of the pandemic, this theory has influenced both the impact and the future arrangement. The pandemic exposed the vulnerabilities of neoliberal healthcare system, where the profit-driving approaches may not be prioritized by public healthcare preparedness. A lack of investment in public healthcare infrastructure and resource left many countries ill-equipped to respond effectively to the crisis. And the governments in neoliberal economies initially rely on the market mechanism and private sector solutions to address the pandemic, such as vaccine development through the pharmaceutical companies. In neoliberalism theory, the actors involved in the COVID-19 pandemics, the impact, and the future arrangement play distinct roles and often influenced by the market-driven principles. Here are some key actors and also their role and their examples. So first one, we have governments. And for the governments, the role in neoliberalism, governments traditionally have a limited role in the economic. But however, during the pandemic, they play a significant role in ensuring the public health and economic stability. For example, government worldview imposed lockdowns and provided financial relief to the business and individual to mitigate economic impacts. And for the private sector, the second one, we have private sector. The role in neoliberalism emphasized that the importance of the private sector in driving economic growth and innovations. For example, pharmaceutical companies like Pfizer and AstraZeneca develop COVID-19 vaccines, amplifying the private sector role in vaccine development and manufacturing. The third one actor is international organizations. The role of international organizations encourage the globalizations and international corporations. International organizations play a role in coordinating a global response. For example, that the World Health Organizations facilitate information sharing and coordinate global efforts to combat the pandemic, illustrating the role of international organizations. The fourth one, we have civil society. So the role of civil society organization or civil society in organization and grassroots movement can advocate for social safety nets and public health measures, sometimes pushing back against purely market-driven policy. And for the example of civil society, advocacy groups like Doctors Without Borders call for equitable vaccine distribution and increased healthcare access, advocating for social and humanitarian values within the neoliberal framework. So the last one, we have individuals, actors. In neoliberalism, individual choice is highly valued, and individuals make decisions based on the available information and incentives. Example for the individuals is people adherence to public health measures such as wearing masks and social distancing, and their choice regarding vaccination are influenced by government message. So the access to the information and personal preference are within the framework of individual choice. And in terms of future arrangement in neoliberal context, there are actors' role that may involve probably governments, private sectors, and also international organizations, civil society, individuals as well. The future arrangement within neoliberalism will likely involve a delicate balance between market-driven principles and the recognitions of the importance of government interventions in public health and social welfare.
Level of analysis. The COVID-19 pandemic has been analyzed through the lens of neoliberalism theory. Here are some key points from level of analysis COVID-19.
first level individual. At the individual level, the focus is on the perception, choices, and action taken by an individual. Real example of case study are: first, individual behavior influence the spread of the virus, such as a compliance with health protocols and social distancing. Second, individual psychology influence their behavior regarding the COVID-19, such as beliefs, fears, and personality. Third, a decline in an individual mental health, such as increase of anxiety and depression. Fourth, the influence of social and economic factor on individuals during the COVID-19 pandemic, such as unemployment and economic uncertainty. And next is level domestic. During the COVID-19 period, governments, officials, and policymakers have implemented lockdown measures that have influenced the environment. At these levels, the government takes several actions, such as: first, impose social isolation, where citizens of different countries are prohibited from going out and carrying out their usual activity, thus harming the global economic situation. And second, in education, the governments decide to close university, public and private schools to control the spread of the virus by replacing traditional teaching with online teaching while maintaining the use of interactive educational tools, including the platforms for course creation and skill development programs. And third, the governments is also implementing mandatory mask regulation and mandatory vaccination to prevent transmission of the COVID-19 virus. And next is level global. At the global level, considering the impacts of the COVID-19 pandemics on the international economics and political aspect. In this case, a country collaborates with international organizations to take action, such as: first, the role of international organizations such as the United Nations or the World Health Organization in dealing with the COVID-19 pandemic globally. And second, international cooperation in dealing with the COVID-19 pandemic, such as a vaccine development and distribution of medical devices. And third is the role of diplomacy in dealing with the COVID-19 pandemic, such as proposing an agreement by the United Nations to overcome the pandemic.
I will explain about the tenets of neoliberalism. Neoliberalism, which first appeared in the middle of the 20th century, is a complex and highly debated economic and political theory. It places a heavy emphasis on the free markets, individuality, and the encouragement of competition. It also places a minimal role for the government in the economy. Despite the fact that it is impossible to discuss every aspect and variance of neoliberal philosophy, the following are some the key tenets. The first one is free markets. Neoliberalism advocates the notion that if allowed to function with little intervention from the government, markets will effectively allocate resources, produce wealth, and support general economic progress. This involves the idea that pricing should be determined by supply and demand, and that competition is crucial. Second is limiting government. Neoliberalism favors a small amount of government involvement in economic matters. In order to do this, rules must be eased, state-owned business must be privatized, and government spending, particularly on social welfare programs, must be reduced. Third is individualism. Neoliberalism strongly emphasizes individual freedom, independence, and accountability. Since self-sufficiency is viewed as being essentially the responsibility of the individual, policy should support it. 4. Deregulation. Neoliberalism pushes for the elimination of several government rules that are thought to limit the expansion of commerce and the economy. This comprises laws governing the financial system, the environment, and the labor market. Fifth is globalization. Neoliberalism often favors open borders, and free commerce while supporting globalization. It motivates nations to lower trade restriction and take part in the world economy. 6 is monetary policy. A central bank that is autonomous and concentrates on monetary policy to manage inflation is frequently supported by neoliberalism. The goal is to preserve pricing stability, which is seen to be crucial for economic expansion. 7 is tax cuts. Lower taxes are frequently advocated by neoliberalism, especially for firms and wealthy earners, in the hope of promoting investment and economic growth. Number 8 is privatization. Neoliberalism is in support of selling off state-owned businesses and public services to the private sector. The idea is that these services can be managed more effectively by private businesses. 9 is austerity. Neoliberalism frequently promotes austerity measures during economic downturns in order to balance budgets and uphold fiscal responsibility, including slashing public expenditure and services. Last but not least, 10 is meritocracy. In general, neoliberalism is in favor of the notion that people should be rewarded according to their ability and merit rather than things like social class or background. So, it's important to remember that the implementation of neoliberal policies and its effects have drawn considerable discussion and criticism. While critics argue that it may promote economic development and prosperity, detractors claim it can result in income disparity, social inequities, and economic instability. Although not without debate, neoliberalism has shaped economic policy in many nations.
Hello everyone, my name is Grecia from Group 4, and here I will explain and share about the history and origin of COVID-19. So the COVID-19 caused by the virus SARS-CoV-2 and the first appeared in Wuhan, China in December 2019 and quickly spread across the globe. In fact, the 48.539.872 peoples and caused by the 1.232.791 deaths in the 215th country. The origin of COVID-19 is believed to come from the wholesale seafood market in Wuhan, which all sells various types of wild animals, include snake, bear, bat, rabbit, frog, and others. Sequence analysis of various coronavirus species relevant that SARS-CoV-2 is a recombination between the various bat coronavirus and coronavirus of unknown origins. And moved to the January 12, a few from the beta coronavirus was declared that the cause active agents of these diseases and the infections was named COVID-19. And then the infections was declared an international public health emergency by WHO in January 30, 2020, with the highest level of concern at the time. And the authority carried out various search operations to find the active case, and the steps were even taken to identify people who had close contact with the infectious person. So the patients with the serious conditions are going to the hospital, and the patients with the mild symptoms are quarantined at home and sent to the special isolation centers. And to control the further spread of these diseases, several restrictions were imposed, including closing the public place, such as school, park, stopping the international flight and local transportations. And people were advised to stay at home and quarantine themselves at home.
Hello, my name is Angelica Benry Mariera. In this slide is about impact and future. Neoliberalism theory is the view that free market and deregulation are the best way to achieve economic and social prosperity. Neoliberalism has quickly been known to have weakened, fragmented, and privatized health system in several countries. The COVID-19 pandemic that has been implemented has clearly demonstrated that neoliberalism, which requires the government role to be minimal, is clearly unsustainable. Significant impact on the COVID-19 pandemics include: the first is the COVID pandemic has demonstrated the need for international cooperation and coordination in dealing with the pandemic, which run counter to neoliberal view the free market and competition. The COVID-19 pandemic has known that the state must have a great role in providing health service and social security for society. The second is neoliberal ideology is associated with poor health and social well-being. The COVID-19 pandemic has known that the state must have a great role in providing health, service, and social security for society. And the last is pandemic COVID-19 has led to a decline in global trade, economic trade, and pandemic debt, which is a component or principle of neoliberalism.
Now I will explain the conclusion of our presentation. So the COVID-19 pandemic, which was brought on by the SARS-CoV-2 virus, has had a major effect on society as a whole, the global economy, and public health. The pandemic's intersection with neoliberalism theories tenets has resulted to many significant issues and key insights. First is challenges to neoliberalism. Neoliberalism, which supports free markets and little government interference, has had its fundamental principles called into question by the epidemic. It has demonstrated the importance of government activities at several levels, from regulating personal conduct to implementing domestic policy and promoting international collaboration to protect public health, education, and social well-being. The pandemic required governmental intervention, which runs counter to neoliberal ideals. Second is importance of international cooperation. The pandemic's worldwide scope has highlighted the importance of international collaboration and coordination. The emphasis on market competition under neoliberalism runs counter to the teamwork needed to overcome a global health catastrophe. The significance of collaboration on a worldwide scale was emphasized, and the roles of international organizations, vaccine development, and diplomacy assume important importance. Last is third, humanitarian and socio-economic impact. The pandemic was a humanitarian disaster and a worldwide health emergency due of its quick spread and intensity. It significantly interrupted economies, international trade, and daily life, demonstrating the susceptibility of even highly developed countries to similar crises. So, in conclusion, the COVID-19 pandemic has shown the need for international cooperation, government involvement, and the significance of health, education, and social security, while exposing the shortcomings of a purely neoliberal strategy to tackling complex global concerns. Additionally, it has shown how widespread the effects of public health emergencies may be, both in terms of human suffering and socio-economic. The pandemic is a significant case study for evaluating the function of international cooperation and governmental action in responding to global health emergencies.